Good afternoon, and thank you for joining us. My name is Tina Tebow, and I will be your moderator for this afternoon's news conference. Joining us today, the Honourable Stephen McNeil, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. Dr. Strang will give us an update on COVID-19.
Thank you, Premier. So good afternoon, everybody. Today I'm announcing 23 new cases of COVID-19, bringing the total number of cases in Nova Scotia to 850. We currently have 11 individuals in hospital, 3 of those in intensive care. We have 392 people today who can be considered recovered from their COVID-19 infection. We now have 24,521 Nova Scotians who have been tested and have had negative results, which is really good news. We have 10 licensed long-term care facilities and an unlicensed seniors facilities with cases of COVID-19 involving a total of 189 residents and 82 staff. We continue to conduct more COVID-19 tests per capita than in any other province in Canada. Yesterday, we processed 888 tests through the QE2 lab. And I want to stress again that early identification of cases is critically important. That's why we still have and will continue to have robust access to testing, lots of lab capacity. It's really important that any Nova Scotians who have symptoms that could be COVID, so that is if you have 2 or more of fever, new or worsening cough, a headache, sore throat, or stuffy nose, we want you to be tested. So if you have those symptoms or think you might have those symptoms, if you're able to go to 811 online assessment. If you don't have online capacity, calling 811, and you'll get further directions regarding testing from there. One of our cases reported yesterday was an individual who, in one of our homeless shelters here in HRM, we became aware of that yesterday. Public health responded. There was also a good response. We have a vulnerable populations team working in government across departments. They rapidly were able to find individual housing in a hotel for the people who were the rest of the people in the shelter who are considered contacts. They are being tested, and we are today we're putting together a comprehensive response plan for this individual and all their known contacts. We're looking at how we work with the homeless population in HRM, knowing that there's quite possibly COVID virus circulating through that population. Moving on, I want to recognize that Ramadan began last night and will continue until the evening of May the 23rd. This is an important religious celebration for many in our community. It's traditionally a time to gather. Many Muslims get together with family and friends for prayers and meals at the end of the day, and there's usually a big community feast to mark the end of Ramadan. Like so many other things right now, Ramadan will need to be different this year. No in-person gatherings or meals, but however, it remains an opportunity for strong connection and building community, even if that needs to be done virtually this year. So I would encourage all those who are celebrating Ramadan this year to see that as challenging as the pandemic is, there is hope in the future, and we will all recover this together. And I wish everyone celebrating Ramadan a blessed and peaceful time. Ramadan Mubarak. And as I said yesterday, as we enter the weekend, I want to repeat some of the things that I said yesterday. I talked about easy access to testing, and that remains an important part of our strategy, along with timely public health follow-up. Those together, in combination with strong public health measures, are what we need to continue for at least a few more weeks. This does mean staying at home as much as possible, good and frequent hand washing, doing only essential shopping and other trips, and maintaining social distance of at least 6 feet from non-household members when you do need to be out and about, and also only getting together with family and friends virtually. Unless you are required to be self-isolating, we encourage people to get outside, to exercise, breathe the spring air. It will improve both our physical and our mental health. If you do so, please do that in your yard or in your local community and maintain social distance. Now is not the time to start going for drives out of your community to go hiking, ATV riding, or fishing in our great outdoors. I just want to remind people that provincial parks, beaches, and tourist attractions do remain closed. Some of our provincial trails remain open, but you should only use them if you can walk or ride your bike to them. In HRM, municipal parks and trails do remain closed. I understand that this seems harsh and is frustrating to some, but it's necessary to continue these strong measures for a few more weeks. We're not out of the woods yet. We need to prevent COVID-19 from gaining a foothold in Nova Scotia, to protect those most at risk for severe illness or even death. We need to do this to protect and respect healthcare workers and other essential workers as they continue to put themselves at possible risk while they serve us. And we need to do this to preserve our healthcare system so it's there when any of us may need it. I've talked about a lot of don'ts, so I'm going to talk about a few do's as well. Please do reach out and contact virtually someone in your community, especially someone who may be alone. Do mourn, honor, and remember, but do it virtually. Do help someone in your community who, because of age or illness, is more vulnerable to COVID-19 and needs to stay isolated. Do work with others to share essential shopping to reduce the number of people in grocery stores or pharmacies. And do be grateful for the many things that we have here in Nova Scotia. I ask all Nova Scotians to do these do's and don'ts as a way of caring for one another and a way of building up our communities. This has been a very difficult week for all Nova Scotians, and my heart remains heavy. The shocking violence of last weekend and the continued deaths of long-term care facility residents weighs heavily on me, as I know it does on you. Please know that it's okay, it's actually quite normal to be struggling with feelings and emotions at a time like this. It's also okay and important to let somebody know how you're feeling and to also allow yourself time to grieve. But also, please talk to a family member or friend and reach out for help if it's needed. There are lots of resources out there, and I encourage people at novascotia.ca/mental health, and the mental health has a hyphen in it. There are a lot of links there to online and phone resources. I want to end by mentioning something from a video that was sent to me a short video that was sent to me a couple of nights ago that really struck with me, and it's called "The Praise Song for the Pandemic." And the video ends with the words, "And when this has passed, may we say that love spread more quickly than any virus ever could." What if our love and caring for each other guides our collective response to COVID-19 and becomes the legacy that we all leave from this historic time? I'll leave you with that thought and wish everyone a safe weekend.
Thank you, Dr. Strang, and I want to attach myself to the feelings of your remarks. This is our 6th week as a province dealing with COVID-19, and I want to thank all Nova Scotians for helping us to try to flatten this curve. But COVID-19 is still making its way through our province, and if we want to reduce the number of cases, we need to remain vigilant. Some provinces are talking about opening up their economies, but we're not there yet. We are still testing about 1,000 people a day, and as a result, we are capturing and isolating COVID-19. But we need your help to continue to reduce the spread. We need you to continue to follow the protocols. Keep your distance, wash your hands, stay at home as much as possible. And I know with everything happening this weekend in our province, this is a big ask. But all of the sacrifices we've made in the last 6 weeks will be wasted if we stop now. I know this has been an emotional burden and a financial one. We've been trying to find ways to support our small businesses who are the heart of our economy and employing many Nova Scotians. We are working to fill the gaps not covered by the federal programs. And today we are announcing that the Small Business Credit Support Program for those small businesses that do not qualify for the federal CEBA program. This new stream provides a guaranteed credit union loan and a small cash grant of up to $1,500 for those that have lost 30% of their sales revenue. Businesses will also receive access to free professional advice to help adapt and recover from the impacts of COVID-19. I'd like to thank the provincial credit unions for the work in helping us and helping our small businesses. We have also confirmed we will partner with the federal government to provide a commercial rent referral for small businesses that have temporarily closed or experienced at least 70% revenue decline because of COVID-19. These programs are designed to put money in the pockets of our small businesses as quickly as possible to help them find their way back when we get through the COVID-19. And with that, we'll be happy to answer any questions.
Again, just a reminder, we'll take one question, one follow-up from reporters on the phone in the allotted time we have. We'll start with Mike Gorman from CBC. Go ahead, Mike.
Thank you. I'd like to first ask about the case in the homeless shelter. Dr. Strang, could you please clarify whether that case is a resident in the shelter or a staff person? And Premier, when these pop-up shelters were first being established, there had been a suggestion, there had been an ask from advocates that this be done in hotels instead of in the municipal facilities the way that they have been. Do you think the province should have done that in the first place?
So I can respond to your first question. This is a resident, somebody who is living in one of these temporary shelters.
As we're going through this entire 6 weeks, things that we now know, when we started 6 weeks ago, we believed asymptomatic people could not pass on the virus. Midway through this pandemic, we recognized that was not the case. So we continued, though, to work and ensure that we provide supports for all of our citizens and ensuring that we're doing it in the best possible way for public health and following the advice of what would be the best structure that was set up, and we looked at what was happening in other parts of the country as well. And I want to thank all of those who are working on behalf of our province to ensure that they're providing housing and supports to the most vulnerable population in our province.
Mike, do you have a follow-up?
Yeah, thank you. Premier, today and several other times this week, the Prime Minister has talked about the need for there to be a collective look amongst governments, both his and provinces and territories, at the way long-term care is operated and offered in this country. I'm wondering what you would like to see from the federal government if they've suddenly decided that they want to get into the long-term care business. But also, I wonder, to what degree do you think the situation in long-term care homes has been exacerbated by the fact that there have been continued issues through the years with staffing and service availability in these homes, many of which operate at a razor's edge when it comes to financial viability?
Well, a couple of things. I think all Canadian provinces would welcome the federal government's continued support in health care. As you know, when the National Health Program began, it was a 50-50 cost share. Right now, less than 20% of it is covered by the federal government. So we would certainly welcome, and I know all premiers have called upon the federal government to move to at least a 25% funding model where they would send dollars in. They could even target that. I've even recommended to the Prime Minister if they want to target their 25%, we'd be happy to work with them to continue to provide the services that they believe should be uniformed across the country. And when it comes to our long-term care facilities, we've continued, and I want to thank all those that work in them. I have the good fortune of representing 3 of them. I've been in a number of times. The professional staff that works inside of these facilities do an outstanding job of ensuring that our loved ones are cared for in a way. It really is, they make it their home, and our loved ones are in these facilities feel like it's their home because of the workers that are working inside of them doing tremendous work. If you look at what's happening across our province, it has started really probably a decade and a half ago or more when we started replacing facilities or modernizing them. We moved away from, we were moving more towards single rooms where individual washrooms associated with those rooms. all of those things are happening across the country. We've just recently announced 2 new renovations that will be taking place in our province. We'll adapt to the new model. But like everything, we will look at what the impact of this pandemic has been on our entire province. And, we'll look at it from a point of view as what's happening in long-term care, and also today with the announcement, we'll be looking at what happens in our shelters, how do we support, and making sure that we have the appropriate supports for our citizens who require care and support.
Next, we'll go to CTV's Natasha Pace. Go ahead, Natasha.
Thank you. I'm wondering, first of all, for the Premier, whether or not you're considering, I know you were asked this last week, but whether or not you're considering bringing the military in to help out with long-term care homes like Northwood. They now say there's 170 residents there with COVID-19, and I know some nursing homes in Ontario and Quebec are doing this. So is that something we're considering now?
Not at this point. We have worked out with our across our healthcare sectors, and I want to thank the Nova Scotia Health Authority and the IWK for providing supports, nursing staff that's going in. Our COVID-19 unit that we had set up at the infirmary has now moved into Northwood. All of the unions have been very supportive. I want to thank the Nova Scotia Nurses Union for the work that they've been doing, as well as Unifor. I appreciated their message about the support that they provided around Northwood, and we'll continue to work with them. We'll continue to monitor the needs of citizens. I want to be clear, last weekend we had already provided full PPE material going in to anyone going into Northwood. That was a request from the nurses union as well as Unifor. I don't want anyone to believe the impression that the decision by the NSGU had anything to do with that. He made that assertion yesterday that was completely false and wrong. What had happened was that had already taken place on the weekend, and I want to thank all of our healthcare partners who've set aside, quite frankly, the differences that we may have at different journeys of our journey together, and focused on our residents and our patients and Nova Scotians. And I need all of us, regardless of what organization you represent, to stay focused on Nova Scotians and stay focused on the people who need our support the most.
Natasha, go ahead with your follow-up.
Okay. I'm wondering, I know New Brunswick, I know you mentioned that we're not there yet in terms of reopening our economy. New Brunswick did mention today that they started to release a plan about how they're going to start reopening certain businesses and things. Have we reached our peak yet in Nova Scotia with cases of COVID-19? And when do you see that we may start to even think about reopening some things in Nova Scotia?
We're working with public health. We have not reached the peak. We're following, as you know, we're continuing to do 1,000 tests a day. This week we had our largest test day in our 6 weeks. We're going to be continually vigilant to go after this virus, to make sure that we contain it and control it, and then we'll begin to look at what are the things that we can slowly start lifting off of the restrictions, not only on the economy, which is important, but on that we've provided on Nova Scotians. As I look and follow this, and as public health follows this around the world, when those restrictions have been lifted too quickly, the second wave actually sometimes becomes worse than the first wave, and we need to make sure that we continue to stay aggressive on first of all finding the virus. That's why the level of testing we're doing is about trying to identify and find the virus so we can isolate it. Once we feel that we've gotten to the point where we can do that, then that gives our success of a relaunch to our economy a better chance to take off. That's why we're doing this work now, working with our partners to make sure that businesses still be here. The cost associated with closure has been huge for them, and we want to continue to try to find out how can we support programs that, say, the national government may not be covering, so that we can be ready to launch an economic renewal. But in order for that to really be successful, we need to continue to be aggressive on this testing so that we can identify this virus and isolate it.
Next, we'll go to Alicia Drouse from Global. Go ahead, Alicia.
Thanks. I'm just wondering if we can get confirmation on how many active cases we actually have in the province outside of long-term care facilities.
I think we have, let me see if I have that number for you, or I may have to get it to you. We have a total of 850 cases. I don't have in front of me the breakdown of those, of how many are actually active cases right now, but if I can do the math. If you subtract 392 from 850, that'll give you the number of active cases. The 392 is the number of people that can be considered recovered.
Go ahead, Alicia, with a follow-up.
And just kind of following up on Natasha's question, I'm just kind of wondering, is there a specific goal that we're actually working towards in order to start looking at easing restrictions?
So as I've said previously this week, I'm involved in conversations, my team, on regular phone calls with public health, other chief medical officers across the country. This has been a topic of conversation for the last week for sure, and it's in two areas. One is, what are the things you need to look at and be able to measure, and what capacities do you have to have in place to make sure that you can actually monitor the disease carefully and have the right approaches in place to follow up cases. So those are the pieces that we have to make sure we have in place. And the second piece is, it's a framework around what are the things you can start to think about lifting and the timing of those. And what we've heard a couple of provinces announcing is consistent with that national framework. But the national framework doesn't give any specific timing. That has to be driven by the epidemiology within each province. So that's what we're looking to bring forward and start some discussions within government next week, and start to then develop more of a concrete plan about how and when we might lift restrictions. But it always has to be driven by the epidemiology, and that epidemiology may change. So we have to continue to have a plan, but then we'll implement that plan and adapt it as the epidemiology evolves.
Next, we'll go to Paul Legere, Radio-Canada. Paul, are you there?
Yes, hello. This question is for the Premier. What would prompt your government to call a public inquiry into the RCMP's response in last weekend's killing?
I've asked the Attorney General to look at what are the possibilities as he works with his national partners to look at what are the processes that could be used to answer the questions that so many Nova Scotians may have, and quite frankly, to allow them to allow the details of this horrible weekend, last weekend, to be put to the test and have those questions answered.
Paul, do you have a follow-up?
Yes, I'm just wondering, when I look at the figures here for today, we're looking at 23 new positive cases. If I compare the figures for the long-term care facilities, there seems to be 34 more positive cases in long-term care facilities amongst residents and employees with today's figures compared to yesterday. Is there something I'm not understanding here between the figure of 23 and the 34 additional cases in long-term care health facilities?
Some of that's to do with the timing of the information we get from especially from the continuing care sector. There may be certainly some time lags in there, and also we report the timing of how we get information into the department. So what we report from the public health epidemiologists is based on what we receive by early in the morning every day, and there may be some time lags between what we have and what we're able to get every day from a long-term care facility. So some of what could be included today for long-term care may have actually been included in some of our numbers from previous days, but we weren't aware at the time that it was actually at a long-term care facility resident or staff. Sometimes we report the case, that information gets entered into our or may not get entered right away into our Panorama, our electronic information system, because we've had to, because of the pressures on public health, create two teams, people who enter the data and report the number, or just the raw numbers, and then the more details of each case gets entered into our Panorama system. So some of the time lags between all the cases being reported and knowing exactly the details around each case.
Next, we'll go to John McPhee from the Chronicle Herald. Go ahead, John.
Thank you. This is a question, I guess, for the Premier. The province is paying for extra prescriptions for pharmacare clients under the 30-day maximum that's been imposed, but that still leaves a lot of people paying for multiple prescriptions, and it means more trips to the drugstore when we're supposed to be limiting them. At this point, should we be thinking of lifting this particular restriction?
Well, one of the things in the rationale for it being in place was really to protect the security of drug supply so that we would have medications there when we needed them. There's always an ongoing look at. I've asked our Minister of Health to work with his colleagues across the country and the national government to look at, is there a way that that we can identify which drugs may be of a shortage and use those as a 30-day prescription, and ones that we know the supply is secure and strong, that we could go back to doing the 90-day one. But that is still in the process, and that's why we announced yesterday that we would be covering the additional fees that are associated with the second and third refill, as well as helping anyone who is on a provincial pharmacare program, including those who are supported through community services.
Go ahead, John, with your follow-up.
Thanks. This would be for Dr. Strang. When restrictions do start to be lifted and schools will remain closed, I would assume, will childcare centers be one of the first things to be able that will open up? I got a question from a parent today about this, and obviously she and many other parents hope that will be the case.
So the timing and how schools and daycares are included, that's part of our national conversations around. There is some emerging evidence around how the COVID virus may be transmitted between younger ages. That's where we have another call, national call on Sunday afternoon, where we're looking to dive into some of that information. So it's all part. No final decisions on anything, and more discussion. But we need to look at each province then, what makes sense for each province. So I can't give any definitive answer at this time, but knowing that we do have to make some decisions next week around schools and daycares about for May and June.
Next, we'll go to Lindsay Armstrong from Nova Scotia. Go ahead, Lindsay.
Thank you. For the Premier, in regards to the small business credit support program you just announced, wondering how that support will be administered and when will small businesses be able to access it?
That'll go through the program through business administered with Dalhousie. It is actually offset from the national program that had a cutoff of 20,000. This will be available for companies whose payroll is less than 20,000, and the support will be there. And 10% of the of up to 1,500 would be a forgivable loan, and the loan in itself could potentially be as high as 25,000, depending on the needs of the business, or it could be as whatever the amount would be required to help support them.
Go ahead, Lindsay, with your follow-up.
Thank you. And for Dr. Strang, I understand widespread testing and contact tracing are crucial parts of overcoming COVID. I'm wondering how many contact tracers are currently working for the province, and if there are any plans to hire more people to do this work as we move into the summer.
So I don't have the exact number. Certainly stay in close contact with the public health team and the Nova Scotia Health Authority. They have created teams that are working on shifts 7 days a week, and they've really deployed all of our public health nurses virtually into doing the contact tracing. They're being supported by our health promotion staff. I've been assured that at this time we feel we have adequate capacity within public health for that. We are looking at different ways of potentially, one of the other things we're doing is following up all the people who have negative tests. We've got some volunteer medical students and some other people outside of public health who are supporting us with that. And we also have some opportunity. We know that we've developed some plans of how we can reach out and get other people beyond public health, even beyond the healthcare system, if necessary, to support support some other pieces of work for public health. So if we need to actually focus those who have the appropriate training to do the actual contact tracing and follow up, and allow them to focus just on that work. So we have adequate capacity right now, and we have plans in place that how to get additional supports if that was needed.
Just a reminder to keep your phones on mute. Next, we'll go to Sharon Montgomery from the Cape Breton Post.
Hi, thank you, Tina. Good afternoon. I'd like to ask Dr. Strang a question, please. Dr. Strang, first, thanks for providing the numbers of tests per zone yesterday we had inquired about. However, when it comes to keeping up with the COVID impact on our province, Cape Bretoners are telling me they feel in the dark about what's actually happening on the island. We're wondering if you would please offer some sort of insight, and if possible, also during future teleconferences.
So we do present data by health zone. An eastern zone includes Cape Breton. That's on our online coronavirus. So every day we update case numbers by health zone. We are looking at perhaps doing that by a finer level of geography. We have to, as I've said before, we have to match that desire with also some needs about protecting the privacy of individuals and some of the challenges around identifying very local communities. But I think for Cape Breton, the message is the same for every part of Nova Scotia. We do have cases of COVID-19 spread throughout the province. The risk of COVID-19 is there for all of us, that we all need to take the steps necessary that we've talked about today, those strong public health measures, and we need to stick with those for a few weeks, because if we let up too soon, even in any one part of the province, we run the risk of a surge of COVID-19, and there are long-term care facilities and other populations of very vulnerable people in all our communities. And the other piece is that Nova Scotia small, people are quite mobile, and then if we have a resurgence of COVID-19 in one community, that just gives it the opportunity then to spread further in other parts of Nova Scotia. So I think we can look at ways that people can get more information about their local community, but at the end of the day, we have to. My plea is that every Nova Scotian and every Nova Scotian community needs to take COVID-19 seriously. Know that the potential for your community is there, and we need to all stick together with our strong measures.
Go ahead, Sharon, with your follow-up.
Thank you. Could you tell us, Dr. Strang, in the Eastern Zone, are the positive cases quite spread out throughout Guysborough, Antigonish, and throughout Cape Breton, or are there actually clusters in some areas?
We've had cases spread throughout in all our health zones, including Eastern Zone. So there's been cases in Antigonish, long-term care facility outbreak in Antigonish. We've had cases in different parts of Cape Breton Island, a number of cases in industrial Cape Breton, CBRM, and we've had 2 long-term care facilities that have had COVID-19 or been affected by COVID-19 within the Sydney area.
Next, we'll go to Evan Taylor from CKBW. Go ahead, Evan.
This question is for Dr. Strang. I'm wondering, I know there's consensus on the seasonality of COVID-19 is that we just don't know at this point, but are there seasonal challenges with spring that we do know regularly non-COVID related? Are there any further stresses that spring brings, or is it an easier time for healthcare resources?
So typically we have spring, we actually coming out of our influenza season, and from an infectious disease respiratory virus challenge, things ease off. But in healthcare we deal with all sorts of challenges, and we know as we move into spring and summer we often get other issues like an increase of motor vehicle crashes and recreational vehicle crashes. So there's always some things in every season that can create pressure on the healthcare system, but you're right. We don't know what for sure how seasonality will affect COVID-19, and we do have to look at the potential for COVID-19 and influenza, or a second wave of COVID-19 and influenza into next year.
Go ahead, Evan, with your follow-up.
My follow-up is also for Dr. Strang. I was just wondering, there were comments made of the U.S. by President Trump about ingesting disinfectant as a possible solution, and it's being condemned by the medical community. I just wonder if you have any comments on how that kind of statement reflects on how a discourse and communicating with people and how dangerous that sort of thing can be.
Well, absolutely there, and I know that many the Johnson & Johnson or Procter & Gamble and Johnson & Johnson bleach companies are having coming out today to warn people that their product is not meant to be ingested or injected. It's really important that we, in an event like this, that we actually allow science to guide our public health measures, to guide how we treat people, and it takes a while to develop some science. There is lots of research going on around the potential ways for definitive treatments for COVID-19. None have been proven effective so far. A number that have had claims on to be proven have shown to actually not be effective. It takes time to develop this science, but there are clinicians and scientists here in Nova Scotia who are part of that research, and they're using that research that will help them guide the treatment of any of our COVID-19 patients here in this province.
Aren't you glad I don't give you any medical advice?
I don't give you political advice, so we're even.
We're a good team.
That's all the time we have for questions today. Go ahead, Premier.
Thank you, Tina. Like so many across the country, Dr. Strang and I are wearing red today. And also, like many of you, at 2 o'clock, we took time to pause to honor Constable Heidi Stevenson, who bravely gave up her life to protect Nova Scotians during the horrible events of last weekend. To her family, we are deeply sorry for your loss and your pain. This evening, I will be wearing my Nova Scotia tartan to remember all the lives that were taken. This vigil is an opportunity for all of us to come together without coming together. And I'm sorry this has to be a virtual gathering and that the physical connection of a hug is not possible. But you will still feel the love and the warmth in this tribute. In Nova Scotia, we have kitchen parties where we have conversations and we play music. My hope is that everyone who watches will feel like they're gathering around the table and listening to some remarkable stories about some remarkable people. To the families, I know this won't take away your pain. It won't replace what you've lost, but it is an opportunity for us to celebrate and honor your loved ones and a chance to let Nova Scotians and all Canadians to grieve with you. So many people from all over have reached out wanting to help. The Stronger Together Nova Scotia Fund has already raised almost $900,000, thanks to the generosity of so many people like you who wanted to help, and a generous donation of $500,000 from Emera on behalf of all of their employees. Today, on behalf of Nova Scotians, I'd like to announce the province will add an additional $500,000 to this fund. We know this money won't take away your pain, and it won't replace what you've lost. How could it? But it is our hope that this fund will offer some relief in your time of need. This weekend will be hard on all families. They have to say goodbye and find some way to move on. Take your time, feel your pain, reach out if you need it, and know that we are there with you.